Good afternoon. It's a rainy day in Vegas. We got thunder and lightning, which is rare here. So if you hear stuff in the background, it is Mother Nature saying hello. Anyway, this is episode 32. Welcome and thank you for joining us. As you'll see, we're changing the format a little bit. We're going to be doing some solo episodes with just me, kind of speaking with you on some either health tips and or some literature that has just come out that I think is interesting, will help a lot of folks. So that being said, I would like to get started just by talking about some literature that had just come out. So this article just came out October 6th this year, 2025, and it was entitled "The Impact of Testosterone Therapy on Prostate Health in Seniors." And I found this to be very, very interesting because, again, when I started doing hormone replacement therapy and getting involved with it, there was a plethora of healthcare providers telling me that if I start doing this, I am going to be the cause of many prostate cancers in my patients. Because the dogma at the time was if you happen to have an abnormal cell in your prostate and you add testosterone to that, that was adding fuel to the fire and it was going to just make a wildfire. And, it didn't make sense to me at that time because when men typically get prostate cancer is when their testosterone levels are the lowest. So just didn't really make sense. And more and more studies had gone on because I think there's a lot of other physicians that felt the same way. And one in particular, Dr. Abraham Morgentaler, kind of went down that pathway and really looking at the effects of testosterone on prostate tissue. And so he came up with what is known as the saturation method, especially when we're talking about testosterone's effect with prostate cancer. And in a nutshell, if you think of prostate cancer as like a plant and testosterone is water, if you take all the water away from the plant will die. Also, if you give it a little bit of water, or it's just the right amount of water, the plant will thrive. And if you drown it, if you give it too much water, it will die. So it's a little bit of like Goldilocks and the Three Bears, not too little, not too much, just right, for prostate cancer. Well, we don't want that. So the prevailing therapies, even up until now, are take the testosterone away. And what we find is a lot of guys suffer a lot of health consequences. So if they find prostate cancer in a relatively young man, let's say in his 50s or even 60s today, and they put them on what they call hormone therapy, which actually is the opposite of it's taking all the hormones away, it increases the risk for all of the things that we've associated that testosterone benefits, but it increases their risk for metabolic disease, for heart disease, for osteopenia, osteoporosis, for dementia. They see I had a hard time remembering that. Maybe I need to up my testosterone. But there's, a litany of health problems from low testosterone that they do this. And when you ask the oncologist or urologist about this, they say, well, they may die from heart disease, but at least it wasn't prostate cancer. So I've done my job. And it just doesn't make sense. And so Dr. Morgentaler kind of looked at the information, and other doctors looked at this and came up with something called bipolar androgen therapy, where they're giving them high doses of androgen once or twice a month. I think it was once a month, 400 milligrams of a testosterone cypionate. I think it may have been an enanthate. I think it was a testosterone enanthate. Very similar half-lives, but 400 milligrams in one shot once a month. And they'd seen that this had a very positive effect on the reversal of some of these tumors and even the spread or some of the distant metastasis of the prostate cancer. So enough about that aspect, but I just wanted to kind of give a little bit of history of where this has come from, that we thought testosterone was a bad thing for the prostate. So this article is looking at testosterone therapy specifically in the prostate. And here's what I found interesting is, testosterone replacement therapy was linked to lower risk of prostate cancer, modestly higher risk for benign prostate hyperplasia, which is enlargement of the prostate, and men aged 65 years or older with hypogonadism. The strength of the association varied based on treatment duration, route of administration, and whether an aromatase inhibitor was co-administered. So, a couple things in here to address concerns about potential prostate-related complications associated with TRT. Researchers analyzed Medicare enrollment and claims data from 2007 to 2020 for men aged 65 years and older with diagnosed primary or secondary hypogonadism. They used propensity score matching to compare TRT users with non-users based on age and time of hypogonadism diagnosis. And they had about 546, well, it's more about 547,000 men and about 413,000 men were in the prostate cancer analysis and the BPH hyperplasia analysis group. So prostate cancer had about 547,000 men, and enlarged prostate guys, there was about 413,000. Treatment categorization included the duration of use. Short-term was less than a year. Long-term was greater than a year. Administration route, whether it was topical or injection, and use of an aromatase inhibitor if it was done at all. Hopefully they had smarter doctors and they were not giving aromatase inhibitors because we know how bad those are. The use of TRT was associated with a 16% reduction in the risk of prostate cancer. The 95% confidence interval, which is strong. So the reductions being observed across long-term and short-term. Mostly, but it was also in parenteral injectable and or topical use. TRT plus aromatase inhibitor therapy was not linked to a reduced risk for prostate cancer. Again, I don't know why anybody would want to use that stuff, but some doctors do. The analysis excluded men with high prostate-specific antigen levels or a family history of prostate cancer, showed that those on TRT had an 18% lower risk of developing prostate cancer. So basically, the analysis that had excluded men from the study showed that there was an 18% lower risk, but in the overall, when they looked at all of the studies, in a lot of studies that did not exclude those men, the overall reduction was 16%. So, you're looking at 16-17% reduction in risk of prostate cancer on average. Now, the use of TRT did show a 13% increased risk for enlargement of the prostate, with a 95% confidence interval as well, with a larger increase seen in the injection versus topical, 19% versus 12%. The use of TRT was linked with an increased risk for enlarged prostate or benign prostatic hypertrophy, regardless of the use of aromatase inhibitor. So long-term use of topical TRT was associated with the smallest increase in the risk for BPH or enlarged prostate. So in essence, what it's saying is initially you might get a little enlargement of the prostate, and with duration after a year, that should calm down. But it doesn't happen in everybody. Some men, we're going to get BPH regardless of whether they are on testosterone therapy or not. And so it's difficult, but it's easy to treat in most cases, and it doesn't need surgery, intervention. We can usually treat it medically. Not always, but in the vast majority of my patients were very successful in treating it medically. So, despite its proven efficacy in managing hypogonadism, many men remain untreated due to the concern about prostate cancer risk. Our findings provide reassuring evidence that may support more informed, individualized clinical decision-making, potentially encouraging reconsideration of TRT among eligible men who have been hesitant to initiate therapy due to fear of prostate cancer or enlargement of the prostate. So, I thought of this as more of a public service announcement because, for years there's been misinformation in medicine. Hell, we're taught it in medical school. There's a great book I'm currently reading, and we'll talk about some of the findings in there in future podcasts. But the book is by Dr. Ludlow, who was a professor at USC and UCLA, teaching in the School of Medicine. And the title of his book is The Lies I Taught in Medical School. If you want to really open your eyes to kind of what's going on out in the world today, I highly recommend the book. I'm going to talk about some aspects of the book. But, the short and dirty of it is we've been fed a lot of BS. And most of us know this. The food pyramid's upside down. There's a whole plethora of health related conditions to our poor food pyramid and the recommendations of the government on how we should be eating. And he delves into some of the reasons for that. And some of them seem to me to be downright evil with when you have studies telling you the information that he points out. And we continue to put things like high fructose corn syrup in our food. We have commercials on TV that used to drive me nuts. I would see the commercial where the lady was talking to her friend. And she said, well, my doctor said that sugar is sugar. And I used to yell at the TV and say, well, your doctor's a flippin' idiot. So anyway, that's enough of my ranting on this subject. But I hope you gathered something. And if you have questions or have topics that you would like us to discuss, please feel free to send us a message and we'll be happy to entertain those ideas and topics. Thank you for joining us.